Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program focuses on different healthcare issues relevant to you, your family, or friends. We have great healthcare providers here to answer questions and give you more information. I hope you'll stay tuned because I've got a great guest on the program today. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Reema Khurram. Thank you for being on the show today.
Thank you for inviting me.
I think, if not the newest, one of the newest the doctors that we have here at KRMC. So welcome to Kingman.
Thank you.
Now your specialty is?
Internal medicine.
Okay, so that's everything inside our tummies? Or
that too, and everything outside as well.
Okay.
It's a combination of things. We provide preventive care, we provide care for all the chronic diseases like diabetes, high blood pressure, high cholesterol. And you know, when you go and see your other special doctors like your heart doctor, they want a primary care doc to coordinate that care. So in case they have issues, we are there to send them where they need to be.
So you're truly a primary care physician?
Yes, I am.
Overall?
Yes.
That's great. So you've been in Kingman 6 weeks?
6 weeks,
Brand new.
yes.
Where did you come from?
Minnesota.
Oh, you're kidding. I'm from Minneapolis originally. So did you do Rochester? Mayo?
I was actually working for the Mayo Clinic Health System, like 35 minutes away from Rochester.
Yes, okay.
And had been there 14 years.
Oh my goodness. You've been there a long time.
Yep,
so
I have.
Wait till the winter. You're going to enjoy it here.
I'm aiming to enjoy that.
He said, I'm from Minnesota originally myself. I spent 35 years there. Kingman is my idea of a perfect winter.
Absolutely.
You can go and play in the mountains. We get snow up there. You can have a snowball fight, build a snowman, and then come back down and be out of it.
I don't think I'm going to miss the snow,
No.
believe me. I know.
Like I said, in case you do miss it, you can just go up and get a quick fix and then leave it and not have to wait for 6 months for it to melt. So I didn't realize you'd been that long in Minnesota.
Yeah.
Very good. Well, like I said, welcome to Kingman. I think you'll enjoy it. It's a good change.
I think I'm already enjoying it at this point.
Good. So your training, where did you go to school and how did you become a doctor?
How did I become a doctor? That's a long story.
So have you always wanted, we'll start at the beginning, have you
Sure.
always wanted to be a doctor?
I actually wanted to be an engineer.
An engineer, like a civil engineer?
Kind of. My father was a civil engineer.
Oh, okay.
And my math was good enough where I could actually go ahead and be an engineer. But my mother decided in Pakistan, where my basic education was, you have to take a track right out of high school. Either you go towards the engineering side or towards the medical side.
Oh, okay.
When that point came, she decided that engineering was not a good field for a female, and that medicine would be a good field.
Okay.
So that's how I ended up, and then I did my pre-graduate and then my medical school from Pakistan.
Okay.
And then I was married while I was in medical school, had 2 children.
Oh my goodness, that's a load. I mean, just going to medical school is a big challenge, and then you had a family.
And after that, my husband thought it would be nice if we could just, you know, we had the opportunity to move to the US.
Okay.
And then I did my residency, which is training in New Jersey for 3 years. And then we slowly moved west to Ohio.
You're working your way. Okay.
Working our way towards Minnesota. Did a year over there. And then I decided I wanted to actually go into primary care, so I really got a good offer from the Mayo Clinic Health System and ended up in Owatonna.
Oh, yep.
Which is just it's on the southern border of Minnesota, close to Iowa.
Right.
Have been there for 14 years and raised my children there.
I was going to say, so your kids must be, are they close to grown up or grown up?
I have a son who's 25.
Oh my
and
goodness,
a
you don't look
daughter
old
who's-
enough to have kids that old.
Thank you for saying that.
It's true. So 25, I'm
and
sorry.
my daughter is 22.
Oh my
So my
goodness.
son just finished law school and actually is in Los Angeles now. That's
Oh,
where
very
he
good.
plans to, settle down.
Well, that's good. We're not too far from
Not
there.
too
It's,
far
yeah.
from here,
Good.
and he said he's not coming back.
He's not going back to Minnesota?
So that was one incentive
Right.
to move. And then my daughter, she decided she wanted to go for her master's. She just finished college
Okay.
in the Western Coast area.
Mhm.
So I decided I'm moving with the children.
There you
So
go.
Kingman really seemed like a really nice area. It's close enough to enough entertainment if you really need
Absolutely.
that. But this is, I just loved it. So here I
Good.
am.
I'm glad. Yeah, we share that with people all the time too. I have 2 daughters that are in San Diego. In fact, I'm going to go see them. But
sure.
what's nice is you can go and visit,
Mhm.
but you're not so close that you interfere too much, right?
You're close, yet not too close, is what
yes.
that's
Yeah,
how it should
exactly.
be. Yeah.
And like you said, for us, my husband and I, we feel that Kingman is in the middle of everything. You can get to Vegas or to Flagstaff or to Phoenix or the ocean's 5 hours away, so
Sure.
you can get all that, but still come back home where everybody knows you, and you just have that small town comfort,
Yeah.
which is a big thing. So.
I'm really enjoying Kingman.
Good.
I am, yes.
I'm glad to hear that. So we talked a little bit about internal medicine, and I know that there's, of course, nowadays in our society, diabetes and obesity are major issues that people. So how do you help someone if they come to you with that?
Diabetes is basically considered a chronic disease. Remember, it's not only one disease, it's going to affect your eyes, it's going to affect your heart, and it's going to affect your kidneys if we don't do anything about it. Obesity is one of the risk factors that if you are overweight, there is a higher chance that you can develop
Right.
diabetes. It's certainly becoming an epidemic at this point. And actually, if you look at the people who are on dialysis, which is end-stage kidney disease,
Right.
the most common cause for people to go on dialysis is diabetes.
Okay.
So
it
our aim
causes your kidneys
is to slowly
shut
fail down,
Okay.
and the only way we can protect people is by controlling the diabetes early enough so that the long-term damage is not there.
Okay. So that's
And
by being on insulin or regulating.
or medicines. Initially, it depends on what your counts are. Some people can just be actually initially controlled with diet.
Okay.
If they exercise, wash their diet, and lose weight.
Right.
If they are overweight. There are a few people who are actually not overweight and yet they have diabetes because it's a genetic disease
Oh,
too,
so
runs
it
in
can
the
be genetic
families.
as well. Okay.
Runs in the families,
Yeah.
and sometimes I have people who don't have anybody yet. It's a sporadic case.
They're
But
the first one.
You're the first one, and now your children
Yeah.
are at a higher risk at this
Right.
point.
Yeah.
So I think this is the way we do, is to make sure that initially we help their sugars under excellent control, so that the long-term damage is not there. And sometimes, in spite of everything we do, in spite of excellent control, you can still have some damage. And but we have good drugs now. We have oral drugs, we have all different kinds of insulin to help people to
With
get
different doses depending
to
on-
meet their goal, blood sugar. And then we have excellent support from KRMC, where we have the patient education for diabetes,
Right.
and other dietitians who are all there ready to help people get to where they need to be.
That's great. I know it is a team approach. We talk about that a lot on the show. All different areas of the hospital that work as a team to help. And we've had Rachel had on the program where she's talked about her diabetes education program. And so I think that's an important thing for people to realize, is when they come as a patient, they're not only seeing their doctor, but they're getting a whole team of professionals that are going to be there to help them with whatever their issue is.
Absolutely.
So that's pretty cool.
Absolutely.
Now, coming from Mayo, of course, I think Mayo is like the one who set the standards for teamwork. It's pretty amazing what they've done over the years, and part of our, a blessing for KRMC is that we're part of the Mayo Clinic Care Network, which allows us to have access to cool physicians like yourself, and our new radiologists that have come, and then we do a lot with the video conferencing, our stroke doc and things like that. So we're blessed to have, or our community is blessed actually, to have that relationship with Mayo.
Mayo is what we call the Mecca of medicine.
Yes.
That's what it is. And I think they really work, they keep working at it to make sure we achieve the highest standards of care.
They're not just resting on their laurels. They're
Yes,
always
no. Just keep working at it. And you have to make changes. People don't like to change. People don't like to do new things.
Yeah.
But that all has to be done in order to achieve the highest quality of care that we are aiming at.
Yes, very good. So besides, then we talked about diabetes, and what other kind of chronic issues do you think you see?
Basically, we take care of all their chronic medical problems, as I said, which includes heart disease, high cholesterol, high blood pressure. I have people coming in who have seen rheumatology for lupus. I'm still their primary care physician, providing care to them if they have issues. It's only when we feel that they are beyond what we can provide that we send them off to see their the other medical specialties that we have, so that they are in touch with them in case they need to have more input from their specialists. We can have that as well.
And again, you're working with that other doctor.
With that other doctor to coordinate their care.
That's one of the cool things too, I think, right now with the new next gen system that we have, that you're able to, everything done electronically. We've talked about that on the program before too, and now with the EMR inpatient as well. So it's going to be so much easier for doctors, I think, too, as well as the patients, to have that information quickly versus having to wait for a fax or patients carrying around a gigantic
paper
folder.
records. Yes, it's difficult to review. Actually, it's quite easy to review through the next gen. I was trained on EMR for 2 years. We've had EMR for a long time when I was. So it was just a matter of learning how to navigate through the system. So I'm not going to say anything because I can always jinx myself and I can have problems as I go back to the office. That can always happen because after all it's a computer. But I think it's really very nice. Once you're settled into the new EMR, it's an amazing tool to have.
Well, and it's the future.
It is the future of medicine, no doubt.
Right. So it's whether if we do it now or do it later, sooner or later.
That's the way medicine is heading, whether we like it or not.
Right. So it's better to jump on the bandwagon and get it going and get it done right. And like I said, from a patient standpoint, to me, what I've seen and heard about it, it's a good thing. I mean, it's going to reduce errors. Things are done for, with the bands and stuff, so they have that electronically, aren't as likely to make mistakes on medications or.
It's very easy. You can quickly review a lot of information rather than trying to go back and forth on pages or looking through the chart. It's just there, right there, quickly, their medicines. And again, when you write, sometimes people can't read exactly what you've written, and once you type, it's all very clear.
Sure. Yeah. Did you have to take a special class on how to write like a doctor?
Actually, no, my writing is pretty simple and everybody knows this is me.
I always there's a couple of doctors here I tease and ask them if they took a special class because their handwriting is so illegible. I'm like, did you learn to write like that on purpose? But that's another thing, you're right, that next gen eliminates that problem. So
it does.
It's good. So you use that or a similar system. So Mayo's been using.
No, it's not a similar system. Each system is quite different, actually. But when you've been trained on EMR, you know how things go. We just, when you move into a new EMR, we just learn where everything is, and then it kind of works the same way.
Okay, so it's kind of like once you've had a computer, you might use different software, but
we know exactly how things go, and we have to be very patient with the computer.
Yes. Okay. Well, we're going to take a quick break, and then we can come back and we'll talk a little bit more about that. Okay. So stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Reema Khurram, one of our newest physicians here at KRMC. Thanks for being on the show again. And you're an internal medicine physician, but we were talking earlier in the program that really means the whole person, the primary care for the whole person.
It does.
So what kind of patients would come to see you?
Everybody, anything
Anybody.
and everybody will be coming in. You know, if they have a headache, they'll come and see me. If they have a cough, they'll come and see me.
Okay.
As I mentioned previously, they have all those chronic diseases, but I am there to provide them their urgent care, as I call it, too. You know, if you have a headache, you have sinus infections, you have a sore throat, cough, you know, we provide pretty much everything.
Okay.
A preventive care is very important, especially with well woman exams.
Right, I was just going to
And,
ask about that. So the well woman can come in for their
and,
yearly checkup.
Just
to
yearly
the
checkup if that's all they want, and I can, you know, I can provide that care too.
Okay. Now you're at the Mountain Shadow Healthcare Facility.
I
That's one of
am.
our newest buildings that we just built with Dr. Joe, right? Sungnam Joe. You're on the Kingman Internal Medicine
It's
Associates?
Kingman Internal Medicine
Okay,
Associates.
very
Yes.
good. So that's right off Wallapai Mountain Road, so that's
It
very
is.
convenient for the folks up there. And I think they actually even have a lab
We
on
do.
site now.
That is very exciting. We do have a lab, so people don't have to go anywhere. Any blood work that we need can be drawn right over there.
So that's really convenient for those on that side of town as well, that again, they don't have to come down to the hospital to have their blood work done. That's
Yep.
great. And it's a beautiful new facility. I know when we had the open house ribbon cutting for it last winter, and it's just beautiful. So it's very nice. And has lots of room for growth, which will be a good thing too. We can add to it as the community grows.
As the community grows, certainly addition can always be, you know, anticipated and
Right.
can be done.
Yeah.
So it's a beautiful facility. I just enjoy the view and
Yes, you get the
Yeah.
view of the mountains,
mountains
right out your office
there,
window.
yeah.
Very
I'm
good.
really enjoying providing care for primary care and internal medicine care for
Good.
The people who are coming in to be seen over there. So
Now I know I don't know if this is redundant or not, but we talked about that your internal medicine is your specialty, but you do primary care as well. But I've talked to doctors who are primary care specialists. So what sets you apart as internal medicine? What's the difference?
internal medicine, we provide actually additional care to people who have more complex diseases.
Oh, okay.
And providing a coordination of care for them. For example, you know, I have people coming in with 10 different chronic diseases
Oh.
that they have and 15 different pills that they're taking.
Oh, wow.
So it's a matter of, you know, juggling them around to make sure everything works smoothly for them.
That's, I would think, a major challenge, number one, and very important, number two, because they can conflict with each other. The medications can, right?
They can,
So
and
it's-
as you know, we all know we do have an aging population.
Yes.
So the complexity of the body, along with the complexity of the diseases, just gets slowly worse and worse
As we get
and
older.
as we get older, because there's natural wear and tear of the body, and I tell that to all my patients. The only way for humans is forward. We can go back, and since we can go back, we just have to take whatever comes our
Yes.
way, and that's where internal medicine is there to provide that you know, coordinate that complexity of care that is needed at that age.
I think that's a good philosophy to have.
I do. You know, we don't have a choice.
Right.
You know,
So
if we
make the
have-
best of
make
it.
the best of
Right.
what we have and keep at it.
Very good. So if you were to be asked what your patient philosophy was,
I think that's what it is basically. Just you know, just take whatever comes and just move forward. We can go back. We cannot reduce what's there.
Right.
As the body moves forward, there's, as I said, natural wear and tear. Not much we can do about it, but we can certainly provide the highest quality of care to reduce that wear
So
and
it's
tear
as you move
and
forward.
make the body move forward smoothly, in addition to all the complexities that are there.
Very good. Well, and I know I call it my getting rusty stage. I'm finding is once I hit 60, it was like, oh my goodness, getting to know parts of my body that I didn't know were going to hurt. Right?
Yes,
So it's just, like you said, learning to deal with them and keeping going is the most important thing.
Yeah,
Well, and we're blessed to have you here and have another new healthcare professional to because that's, I think, one of the biggest challenges we have here in Kingman is getting enough doctors. You know, and Kingman is an awesome place, but we keep growing, and so as the population grows, we need more healthcare professionals.
Absolutely.
So it's great to have had you join us, and we have a number of Mayo trained. Our radiologists now we got 6 of them, I think it is,
I
that
know,
are here.
and I've met all of them.
Have you? Did you know them from before when
I
you were in
did
Minnesota?
not, but
No?
we all knew each other. They knew where Owatonna was,
Yes.
and you know, we do. You know, it's just such a huge place with
No,
so
it
many
is.
physicians. It's difficult to know everybody that's working there.
I know. I went to well, of course, growing up in Minnesota, I knew where Rochester was. I'd been through it, but had never spent any time there. But I went last winter to a conference with Mayo, and it was just amazing to me. I mean, pretty much the whole town of Rochester is geared around Mayo.
It
Yeah,
is.
it's
It
amazing.
is.
I mean, almost every other building, I think, has Mayo on it.
It can be overwhelming initially when you go there, but once you know your way in and out, I think it's pretty easy.
Oh, it's an amazing system, and it's so well organized from a
It is.
patient standpoint, too. We have a lot to learn, I think, from them. They have some really valuable tools that will help us provide better patient care as well. Another advantage to being part of that Mayo Clinic Care Network. So off of work, we'll talk personal for just a minute. What kind of things do you is your husband here with you as well?
I have a husband, yes, and my daughter is here too.
Oh, good.
She is planning to go for a master's, and so she's at this point trying to see what will suit her, and somewhere close around in Arizona or Vegas or maybe LA where my son is.
Very good.
So she's working on that, and both of us are really enjoying the nice weather and
Good.
anticipating the nice winter we are
Yes.
going to have here.
I know I go back to Minnesota once every 10 years in the winter just to remind myself why I don't live there anymore.
I don't think I will do that. Go back.
It'll be a long time, believe me, before you'll miss it too much. But so what have you found to do for fun?
I like swimming.
Oh, good. So, you got
So
the
that's a
river.
good sport
Yeah.
to have, and basically just rest, reading. Reading is a good hobby I have.
good.
Whether it's reading books or now reading over the computer,
Yes,
it's still reading.
Yes, yeah, with the Kindles and all that is nice. And now, have you had a chance to go up to the Wallapies? And
No, not
Not
yet,
yet?
not
Okay.
yet. I think we're planning to maybe go there, and we're just settling down
Sure.
slowly and
yeah,
steadily.
6 weeks. You've barely been here.
And with the new transition into a new clinic, and of course the new EMR with next gen.
That's true. You kind of
So-
hit the ground running, didn't you? You
I
get here
did.
and boom. Nothing gradual about that transition.
No, but I think everything falls in place slowly and
Very
steadily,
good.
and I hope to be here forever
Long
and
time.
ever, as I
Good.
call it.
Yes, yeah, that's what my
So
husband
I'll
and I
have
said. We
lots of
Good.
time to do everything that needs
Oh,
to be done
absolutely.
around here.
Very good. Well, I know the Wallapies are fun, I think, too, because they've shared with you, we have a great lodge up there. You can go for nice dinner or lunches, and they have elk and deer that come right up to the big windows. You can eat lunch and watch the elk. It's pretty cool. They're very domesticated almost. But there's lots of fun things in the river with the water sports, so I think you'll find lots of good things to enjoy.
Oh, I will, I know.
And hopefully everybody is going to make you feel real welcome and part of the community.
They have.
That's good. Now I should have looked this up beforehand or asked you, do you know the number for the clinic if someone wants to call you, if they'd like to make an appointment?
Our clinic,
Mm-hmm.
it's I think 928 and 263. Actually, I'm sorry, 928-681-8703. I think that's what it
Okay,
is.
well, they can go to our website. I always tell people to go to azkrmc.com, and they can look you up under Find a Physician. They'll find your face there, your name, and then be able to get the phone number and call to make an appointment so they can come in and see you.
Yep.
I think they'll be in good hands. And again, thank you for being on the show. I'm glad you're in Kingman. Welcome. I hope you enjoyed our program today and that you'll join us again next week. I'll have another great guest on the program. Take care.